Good morning and good morning to your viewers.
Good morning. What will the department do to the doctors who, of course, refused to be deployed in rural areas?
Fortunately, the appeals committee met yesterday and the issue seems to have been resolved. We have crossed the bridge. Only 3 cases out of the 36 have not been resolved. We have declined their appeals.
Now, does the contract that the students sign when they get the bursary specify what will happen should they refuse to be deployed in rural areas?
In terms of the contract, if they refuse to be deployed and serve the Eastern Cape, they would be required to pay back the money that the department would have spent towards their studies in lump sum. And there's also a penalty fee of 16%. And we don't accept that money to be paid in installments. But fortunately, for this time around, it doesn't look like we'll have to take that route. We are now, the department will from this morning begin to conduct all the doctors concerned.
Now, so of course,
it's unfortunate that...
Yeah. No, it's okay, continue,
It's unfortunate that we introduced the bursary scheme as another intervention to address a severe shortage of health professionals in the province. Us being a rural province, we felt the need to assist students from poor backgrounds to ensure that we get more doctors and other health professionals. So this does not only relate to doctors, it also includes nurses and other health professionals.
Now, we can't ignore the fact that, of course, the hospitals are affected by the doctors not being present there. But what is the extent of the effect, of course, in the hospitals where the doctors have to be deployed?
Well, the rural hospitals are always the worst affected because of the rural nature of the province. Of course, there are also other issues that would be raised by the doctors themselves with regard to the conditions in those hospitals, but the department over the years has been trying its best to ensure that we address some of the challenges faced by the rural institutions. For instance, we've spent the past year building decent accommodation in a number of rural hospitals, especially in the eastern part of the province, and we continue to improve. And also, in terms of the general infrastructure improvement, we are currently spending over R1 billion to ensure that we rebuild, we demolish the dilapidated structures in the Transkei to build new hospitals, and we've already built new hospitals, especially in that area, because that's where you had backlog when we took over as government. And for instance, in Makwane, we are completing a project there which is costing the department just over R1 billion to rebuild that hospital. Here in Port Elizabeth, this month, our oncology unit, which is also a multi-million rand project, has started its operations. Similarly, in East London and Tre, we have also opened a new pediatric ward there. So we continue to improve conditions in all the hospitals, but the focus is on rural hospitals like Chanyana, Nesinite, Sipetu. Already construction companies are on site in Madwaleni. We're building a gateway clinic there for 38 million rands. That is part of our intervention to ensure that we improve the quality of service and the conditions in those areas.
But MEC, have you received any feedback from the doctors as to why they do not want to go back to the rural areas that they have been deployed to?
Well, we take that as cheating. Because I can tell you, my office, for instance, now is currently inundated with appeals and requests for bursaries. So those who still want to pursue health-related studies, they still need assistance from the department. And every year we spend over 100 million to ensure that we award bursaries to those interested in pursuing health-related studies. But it's very disappointing that once they complete their studies, they see this province as rural. They take our budget to other provinces simply because we are a poor province, simply because we are a rural province. And I can tell you some of the excuses that have been submitted by some of the doctors were just silly.
And would you say that the doctors have a leg to stand on should they still refuse to be deployed?
I'm very happy that we have managed to cut down the list from 36 to 3. And even the excuses that were forwarded by the 3 doctors, I think we can engage with them because, for instance, one of them doesn't want to go and serve in Tsolo, which is 40 kilometers away from Mthatha, where she prefers to go. And the reason is that she wants to be closer to her boyfriend. We cannot accept that. Here, we expect those doctors because they have been assisted through taxpayers' money, through the budget that was allocated to the Eastern Cape. We expect their skills to benefit the communities of this province because we spend that money for that purpose. In fact, we are also strengthening the intake and this budget, bursary allocation, because we're now engaging with local leaders, church leaders, traditional leaders. We have introduced what we term social compact, so that if we send you to Cuba or to any of the South African universities, if you're from Tsolo or you're from Libote, from the onset, you know if you leave Libote to Cuba, you know from the onset that once you complete your studies in Cuba, you come back and go and serve one of the hospitals in Libote. But we then said, let's introduce the social impact compact where we involve every community member to ensure that we retain the skills within those communities, because we can't continue to produce doctors. If I can tell you, over the past 5 years, the Eastern Cape, through the bursary scheme, has introduced over 1,000 doctors. But some of them have left this province, so we are putting a stop to that.
Yeah. Well, Sizwe Kupela, thank you so much for joining us on AM News and updating us.